doctors live up to 100 years. The second thing, how do you get people to do medicine today? You are asking for healthcare. People don't want to join medicine today. IT gives you 20 lakhs package in your first year. You join an IIM guy, he gets a 20 lakh deal. A poor doctor at 31, after 13 years of hard work, gets 56,000 rupees per month. How do you make him attracted to go to medicine? It's a huge challenge. So to make medicine attractive, we have to cut down. The courses were huge, so we make them shorter, make them more exciting. And what we call as a concept of Indian Medical Graduate, IMG. So if all that goes through the government, you will have a standardized product and less courses. And there will be time for poetry, there will be time for humanity, there will be time to do something else other than just, you don't become a dud after doing medicine. So to make medicine attractive. But then, where is the money? So we innovated, and I think that's the only course in the world where you can go offshore 6 months. So you do your medicine, but 6 months you can go to an industry and learn how to make walls, or you can make how to make probably something else, and you come back and work. So you can be an innovator and entrepreneur. That's a new change in the curriculum for post-graduation. So now how come investment opportunities from US or from Houston? I want you to think creatively for your country. You know the problems. I'm telling you the problems. So one problem for one issue, we want your support in the sense, give manpower, give your time, give your commitment for teaching, whichever way. Each one of you have achieved excellence. That's one thing. But there are industrialists here. What is their stake? That comes healthcare. Healthcare in India is more expensive in private sector than in government sector. Very expensive for India. And it is only available in a tertiary setup. As rightly said by Mona, that well, can you go to a primary center? About 25 years ago, I went to Canada. When I was at Yale, I drove up in a 5,000 population of a small village. There was knee transplant available. I mean, a total knee replacement was available. It's not available in India, even in districts today. You all can give that kind of support. You can create an environment there by which all those Indians who are there, you can create the facilities go down. About 3-4 years ago, some doctors came, the RP group came and they met our Chief Minister Sheila Dikshit in New Delhi. I hope you all know Sheila Dikshit, the best Chief Minister India ever had. So they were all talking about diabetes. We can do this in diabetes care. The cardiologist said we can do this there. And this simple lady said, मुझे एक बात बताइए, अगर मैं एक गांव की लेडी हूँ, तो मेरा blood pressure कैसे देखना? I'll translate. This is what her actual language was. If I am a simple woman of a village, tell me what blood pressure does to me. Will I die? Will I have a problem? Her message was so simple. You translate healthcare into simple language. Give me for 10 diseases, do's and don'ts, and give it all over Delhi. Her message was prevention. Her message was simplicity. We haven't been able to do. All the American doctors, the senators were there who said, yes, in 6 months we will open an office here of health education for the people of Delhi. It has never happened. So first is the brain and your teaching and time. Second is simple ways of spreading message of health and well-being. Now, there are several challenges that we face. The challenge is we import everything from US as far as our equipments are concerned, as far as our technology is concerned. What India needs today is a huge industry of developing equipments. I would invite any one of you who is interested, today it is the time. There was a hepatitis vaccine by Glaxo. It used to sell for about 1500 rupees. Shanta Biotech in South made vaccine which is available for 7 rupees. 7 rupees, that's like 10 cents, am I right? Something like 10 cents. And they export maximum number of doses around the world. That established that India can make all these kinds of vaccines. Today, I think what India cannot make is the kind of tools like a CT or an MR or an angiography machine. These are what India requires. And why do we need all this? We need this because we need to cover a huge population, 1.2 billion. How many can you import? So to decrease the cost of healthcare, we have to have simple horizontal hospitals, not too expensive. We have to have good machines which we can make there. And I think if the Indian chamber here and the industrialists here would like to think, all this can become possible. And those who establish today in India as a healthcare would actually reap the benefits all over Asia. I also would like to invite you to think about partnerships like Baylor, like MD Anderson. These are huge institutes. I was there for 3 days and I learned so much about cancer and the way MD Anderson cancer prevention programs are there. But I realize sometimes MD Anderson and others, they tie up with only rich institutes. Don't misunderstand me. What MD Anderson or institutes like Baylor or institutes like, St. Luke's or so, they should also tie up with some other government institutes. Or if you all have, there is an opportunity for investment which is different. But for Indians, there is an opportunity for providing healthcare of that quality. And therefore, I encourage all of you who have a say in this country to make sure that they also tie up with other places. Coming back to some of my reminiscences when I was at Yale, I was telling Dr. Loba Mishra how educated. When I was at Yale, I was offered several positions in Midwest and others to start new departments and I went back. And I went back and I never regretted. I found it was very rewarding. It was an extremely useful time that I spent here, learned here. But what I learned here was something which I never learned in India. The learning was to be precise, to be very transparent, and to do work before others tell you, you haven't finished it. You always work ahead of time. I came for one project and I could finish 9. I was given compliments. The guy who was working with me in the animal house was doing 3 jobs. This guy would come in the morning, clean the cages, go in the afternoon and would study somewhere. In the evening will teach tennis, and till late night will teach tennis and earn money, and in the night will work in a restaurant and earn money. But that's all with a government job. In US, he was able to do 4 jobs despite being in a VA hospital. But that is not possible in India. The reminiscences of that place was he could come at this time, he would finish his work, he could go there. In India, we cannot do it. So we want a system by which we can make 3 or 4 salaries in India for our doctors, for our healthcare industry. Some times ago, I was reading a book on Chanakya. Chanakya said, I don't make right decisions. I make decisions and make them right. That was a very wise saying in those days of Chanakya because the kings used to listen to him. What we did in 1 year also did something what Chanakya did. We did decisions and we then converted them into right. Some of them were not the best decisions, but 2 or 3 decisions when in the medical council we took were very, I think, were very positive. We made government agree to open medical colleges, not private sector. Today in India, 62% of medical colleges are privately run. All that money from South. 70 members of parliaments and several ministers have their medical colleges. It's a very rich opportunity. And there's a huge amount of capitation. So what we said we will do is a common entrance test. Everybody has to appear for an exam so that a guy who is working in Delhi or a guy who is working in a small town under a lamp post can also appear. If he's bright, he can come. And the capitation and corruption, huge resistance to that. But we decided, the Supreme Court of India approved, and hopefully this will be implemented. So that was one decision, and now all engineering colleges, law colleges, all studies are following a common entrance exam. The second thing which we did, hopefully, will be a licentiate exam. Everyone who passes out is of the same, whether he comes from Bihar, Delhi, Odisha, or somewhere else, Rajasthan. So there will be an exit exam, and that will be a standardized product. Coming back, I think last 1 year what I learned was very huge, very interesting. We have developed a liver institute in Delhi. All of us are liver people, Dr. Lopa Mishra. What one message is, she said very silently, very with great respect, but obesity, 4 times more liver cancer, diabetes, 2.5 times more liver cancers. But it is not merely liver cancer, it's prostate, colon, breast. So obesity and diabetes are 2 of the major things in India. I'm not sure America is going down, but India is going up. I think if you all make an effort to have a healthy life, we will be prevented. Thank you once again for calling me here.
Are there any questions from the audience for Dr. Sarin at this time?
My name is Katilia, so I actually know who you're speaking of, but my point is, I was recently at the American Telemedicine Association, and I was quite impressed to find out that India has a very active telemedicine group. My question to you is, do you think it's possible, or is it a necessity to have the specialists that are of Indian origin or otherwise, kind of like Doctors Without Borders, to be able to give back to India by being able to work in real time to provide some of these specialties to fulfill the needs of people in the rural villages? And not as a commerce question, but as a question of giving back in terms of charity.
I would be really very happy on that, and I think it's not only telemedicine, it is telehealth which you will give. But how will you make it happen? Whatever way, I am there to support at all levels, and we need it positively.
And Dr. Ipan is familiar with that, and that would be a great question for him to answer as well. If
Hi, I am Ipan. I work at Christian Medical College in Vellore in South India. We have, as Dr. Lopa mentioned, we have an active telemedicine program going on at Vellore, and a variety of departments all departments are encouraged to utilize this facility, and different specialities link up with corners of India and use this to both train doctors as well as for patient consultation. But it's more for training doctors when it is done. We have a link up with Christian mission hospitals all over India, and a lot of these are located in rural areas of India, and it's actively going on for that. For example, hepatitis B, we have an active program there.
So, Ipan, is there a role for the US counter? That's what you're suggesting, right?
My question is, there's technology is obviously, when you think of intelligence and technology, you think of Indians and software engineers, and I think there's quite a few Indians in Silicon Valley that have kind of definitely thought this process. I think the general concept is if there's support, I think regulation has always been an issue. That if they can indemnify physicians here that want to give back and be able to provide original services in India.
The government of India is launching a program of 200 crores for telemedical network, but none of these programs goes to villages, what you are saying, except what Dr. Evans said for CMC Vellore, the outreach of this is to limit it to medical colleges. But I think if you have, we can just talk it out and get it done positively.
Great. Thank you. Any further questions? Yes, Dr. Rashid.
Just a comment actually. We all know that cancer is a disease of life. And what I'm seeing actually when I'm in India is on the television you see all this Bollywood in the morning, right, at 7 o'clock. And it's 5:30, around this, preventive measures that we just shown. So are we doing anything to really educate the general public that it's a preventable disease and how we can really prevent cancer? I think that would go a long way.
You're absolutely right. I was also not aware. Yeah, his question was, thank you, Tiloka. The question was, are we doing something in India for cancer prevention, especially for the next generation, for the children? And I think we are not doing, we as doctors are not doing. I only got to, stimulated with the cancer prevention programs after coming to MD Anderson. I think we have a long way to go and maybe you can help us. Definitely.
Yeah, thank you. That was very informative. You provided us a lot of statistics and numbers. But my question to you is the Medical Council of India taking any steps to provide physicians who are interested in doing research some kind of secure time? Because like you said, everyone is overworked, even more so in India. So, but that is where they need the support.
Yes. That's the challenge. Actually research is a religion. If the physician wants to practice that religion, he will find time. It's something. But the government cannot. In our Liver Institute, we have a rule. Everyone works 4 days. He has 2 days, Saturday and whatever day he wants. They are for full time, they're paid fully. 2 days off, they can do what they want. But the rest of the country, I think not. But we have started an MD PhD program, in which if it comes, you can do an MD and a PhD together. But
Yeah.
no separate research time.
Yeah, but just in the universities and the medical colleges, if that is the place they need your support. And if the Medical Council of India could intervene, that would be very helpful.
Every college this year, I think, is getting to the tune of 1 to 5 crores. Every medical college is getting set up with a research facility. The 100 first medical colleges have already given the grant by Indian Council of Medical Research. But as I said, even if you support, what we want in India is do something, even if it is wrong, get the attitude. And I think it is coming.
Thank you. So in the interest of time, thank you. We will move right along to Dr. Epen. And he comes from a totally different background, and you've already heard some of this. He's a professor of the Department of Hepatology at Christian Medical College in Vellore, India, and his research work focuses on vascular liver disorders at Christian Medical College. Now, Vellore is a tertiary level hospital catering mostly to patients from southern and eastern parts of Africa, and he'll tell you a little bit, India, not Africa, sorry, these Freudian slips. And he'll tell you a little bit about that.